cases here in D.C., but we are certainly preparing, making sure that our health department as well as our Homeland Security Agency for D.C. Is working together with all of our agencies to be prepared for any health challenges that arise in the district.
Is the position that we're going to get cases eventually?
I think that we've seen, I think when we saw the first cases reported in New York, and I think there's been a case reported in Florida, were all places where there's a lot of travel and people coming in and out. And so we're just asking people to use common sense community hygiene practices, including washing your hands, using soap and water, making sure if you're sick that you don't come to work, that you kind of don't spread your germs. Call your provider if you think you may have been exposed. Call ahead, even before going in to see your doctor, so that they can give you some instructions.
What about city workers, though? Police, fire, you know, they work close, you know, our hospitals, our clinics.
Well, what we did, Bruce, is last week I convened a huge meeting. Our government agencies, as well as stakeholder groups, our hospital association, our Department of Human Resources, our schools, to get information out to folks. We don't want to cause a scare, but we certainly want people to be prepared and use these common sense community hygiene practices.
Have you got a sense about possible hoarding? I'm hearing reports, and a lot of it coming from the media, about people going into drugstores, food stores, stocking up, including medical supplies. A large percentage of our medical medicines come from China, so people are hoarding.
Well, we want people to have the medications that they need. We want them to have things that they would have preparing for any flu season, to have, you know, fever-reducing medications, to have Kleenex, to have water and food in case you need to stay home for a few days, to have all of those things on hand. We don't think that the average person needs to wear a mask. Right. In fact, we think people trying to hoard masks would make them unavailable for the healthcare professionals who need them.
Okay, we got the all-important Cherry Blossom Festival coming up. It puts a lot of people in hotels here. People, tourists come here, they see the other sites, they go to the restaurants, they spend a lot of money. Have you heard anything about cancellations, reservations?
Well, we're certainly concerned because we know that a lot of travel is being restricted, both internationally and domestically. And so we want to let everybody know that our hotels and restaurants are also following good hygiene practices, so they should feel safe going to all of our events. DC is open. We're not shutting anything down. Our Cherry Blossom Festival will go on as planned. And in fact, most people who come to our Cherry Blossom Festival are coming from right around in our region. So we're open and we are prepared. You should know we're the nation's capital, and we have a very sophisticated agency network, not just in DC but across the region, to prepare for any health scares.
Some 8% of the people coming in for the Cherry Blossom are flying internationally. I'm just going to go right to the point. You're concerned about, say, Japan. I mean, we got the trees from Japan. You know they're going to be here. It's an annual pilgrimage for them. Are you concerned about flights coming out of Japan?
Well, there are a number of restrictions that the State Department has issued about flying, and we're giving that advice to our residents. We're going to give that advice to our school children as well, who may have spring break trips planned. All of that information is available on dchealth.dc.gov, dchealth.dc.gov, and there you will see all of the travel restrictions. But it is important, while this virus started in China, is more related to the geography and not to the people. So we don't want to give anybody in the impression that they should stay away from certain people. They should just, as I said, follow good hygiene practices.
Okay. We don't know how many people are staying away from Chinese restaurants and maybe other eateries, but we've covered this story, and other people have also. People have decided on their own, certainly without direction, you know, from you and your office, Not to go to Chinese restaurants. I mean, they're avoiding certain foods. What do you think of that?
As I said, while the disease started in China, you don't have to avoid Chinese people. What we have to do is all follow good hygiene practices, washing our hands, staying at home if we're sick, avoiding being around people who may have colds in close proximity, and the like, and cleaning frequently used items that people touch.
Okay, you haven't changed anything about your coming and going. You haven't changed anything about your daughters coming and going. Yeah.
I have not, although I did wipe down my house with Clorox wipes. And I'm going to just, as I said, I'm pretty vigilant as it is because I have a baby at home, but I just going to use that as an extra precaution.
Okay, stay with us.
Thank you.
We're going to be back in a few minutes to talk to the mayor about the recent crime uptick in the district. Stay with us. So time to send in your questions. You can text us at 202-895-5700. Okay, we're still live on Facebook, and I can't think of anything else that I haven't asked you about the coronavirus. Is there anything going on, with the city? You're wiping down your house. I mean, what about city employees? I mean, are you guys meeting? Are you having sessions?
Yes, we had a big session last Friday where I probably had 30 agency directors plus outside folks, people from COG, our National Guard, our sports and entertainment folks and hotel folks, our destination folks, our human resources people. So our directions to our employees, we went out, send out a big communique to all DC government employees. The schools will do the same to parents.
What about our shelters?
Same issue. And so all of our government buildings are managed by DGS. And I do have them looking into increased cleaning and disinfecting, and that's how we'll do it.
Okay, good. Scroll up to my next script so I have some idea of where we're going. Okay, I got that, but I need to. Okay, all right. So we got sound at the beginning. We're going to give them an update on Malachi, if there is one. Yeah, letting people out there on Facebook Live know we're going to be talking about violence coming up next. And what the Bowser administration, with the police chief, what we're doing to curb the violence. Who are the targets? Who are the perpetrators? I mean, let's talk about that too. I was talking to somebody in the newsroom, and you kind of got the impression, or at least this person kind of had the impression, that it's pretty widespread, and every young African American person might be involved in this, and that's just not true.
I want to get your approval on this.
4 to 5.
Yeah, I can get that later when we get to Bluebird and all that kind of stuff. Okay, for those following us on Facebook, we're going to dip to black for a short period of time, then we're going to come up live on air, okay?